Hello, everyone. Good morning, and welcome to today's modeling symposium, which has been organized by the School of Public Health and the Michigan Institute for Computational Discovery and Engineering. As mentioned, my name is DuBois Bowman, and I have the privilege of serving as Dean of the School of Public Health. Over the last year, I've seen University of Michigan faculty, researchers, staff, students from across the community respond really admirably to the COVID-19 pandemic. And this important work has taken place at many levels, locally here on campus, in our state, throughout the nation, and even examples spanning the globe. And a critical aspect of this work has been the use of mathematical, computational, statistical models to better understand the virus and really to try to help guide decision making. I'm a biostatistician by training, and so I'm keenly aware of the importance of having access to high quality data, as well as developing rigorous analytic frameworks for estimation in certain circumstances where appropriate, for inferences, but importantly also for predictions about what may be forthcoming. Since the pandemic took hold, thinking back to March of 2020, I've seen the general public come to understand how important data are in a public health crisis. And I've seen a newfound appreciation for modeling, statistics, and for those who do this critical work. The modeling community has been indispensable to our COVID response efforts. And so I want to recognize the tremendous work that they've done to guide us. And thinking back again to this early period in March, we faced a novel situation, and it was the modeling community that really helped us to try to make sense of it and help us brace for what was coming. In the early days, there were so many unknowns, so many open questions. We were unsure exactly how the virus was transmitted, how fast it spread, how much asymptomatic spread was occurring, the incubation period, and so many other factors. And we had to think about keeping our communities safe amid all of this uncertainty. And there were very limited data to help guide us because, again, we were facing a novel situation. And models aren't crystal balls. They can't, perfectly predict the future, and no one model can solely provide all the answers that we're looking for. But what they can do is they can help to give us different perspectives to consider as we make decisions about how to protect our communities, in this case from the novel coronavirus. And despite the many unknowns related to the pandemic, there was a clear opportunity to use modeling, and the community dove right in from the very beginning, beginning to put pieces of the puzzle together. And as more data became available and more accurate models developed, another important question arose, and that was, how do we get this information to the people who need it? And I've seen modelers team up with health officials, state politicians, even our governor here in the state of Michigan, the state's Youth Soccer Association, campus leaders, and so many others in decision-making positions who are really in search of information to help try to reduce uncertainty to guide their decisions and actions. On campus, we first needed to integrate different data sources and then to model different scenarios so that we could anticipate future outbreaks on campus and either plan to intervene early or ideally even take preventive measures to stop them before they happen. Modelers also translated their work to help policymakers understand disease trends, which has led to important social distancing requirements or stay in place orders at the level of the state and even the county at times, and have helped to really keep us safe. Many models have also been placed online so that the general public can see and learn about predicting disease spread in an important effort of transparency. And this has been particularly important for helping communities understand just how the safety precautions that they take can impact, not only them individually, but their communities and their neighbors' well-being as well. Marissa Eisenberg, who you just heard from, is an associate professor of epidemiology and mathematics and complex systems and Emily Martin, who's an associate professor of epidemiology. They're both members of the School of Public Health and the symposium organizing committee, and they've been really at the helm of many of the examples that I've just described. They've gone over and above with respect to kind of academic norms over the last year to help our campus community and our state respond to the pandemic. And there have also been so many others involved in this critical work. In addition to the School of Public Health, countless other schools, colleges, and departments and centers have played a really important role. And it's been a moment when the interdisciplinary strengths at the University of Michigan really shined. And I think that the agenda for today's event will demonstrate that. You're going to hear from a number of talented faculty across the university who've contributed to modeling work in many ways. One of the things I've been most proud of during the challenging time is seeing so many at the university community step up to apply research skills, expertise to make significant and really life-saving contributions to society. And so it's a clear demonstration of the value of a university to serve the public good. And I'm delighted that this symposium today will provide us with a chance to highlight some of that great work. So thank you to the symposium organizers, our panelists, our participants, and everyone who's attending today. You're in store for a great event. I hope you'll learn a little bit more about the critical importance of mathematical, computational, and statistical models. I certainly also look forward to attending and learning more about some of this exceptional work. So with that, I'll say thank you and turn it back over to you.